You've probably heard the word peptide in fitness or biohacking circles. Most people act like they understand it. They don't. Here's the truth. Peptides aren't steroids or supplements. They're signals. Small chains of amino acids that tell your body what to do. Heal faster, burn fat, build muscle, sleep better, look younger. Your body already makes them. Scientists just learned how to use them with precision. In the next 8 minutes, I'll break down 8 of the most talked about peptides. What they do, how they work, and what you actually need to know. No hype, just the real picture. Peptide 1, BPC 157, the repair peptide. Think of your body like a house. Normal wear and tear happens every single day. A crack in the wall here, a leaky pipe there. Most of the time, the house manages. But when something breaks hard, a torn tendon, a damaged gut lining, a muscle that just won't recover, your body's repair crew shows up slow. BPC 157 is like calling in a professional repair team. It stands for Body Protection Compound. And what it does, at its core, is accelerate the signals your body already sends to damaged areas. It improves blood flow to injured tissue. It speeds up cell repair. Tells your body, fix this now. People who use it report faster recovery from muscle injuries, joint pain, chronic soreness that just wouldn't go away. Gut issues, things like leaky gut, inflammation also respond to it because BPC 157 works on soft tissue across the whole system. But here's what it is not. It is not a superpower. You cannot take BPC 157 and go lift twice your max the next day. It doesn't prevent serious injury. It doesn't replace smart training or proper rest. And one more thing you need to know, most of the research on BPC 157 right now is animal-based. The results are promising, very promising, but human clinical data is still catching up. So it's a powerful tool, just not a finished one. But fixing damage is one thing. What if your body could also burn fat faster, without even trying harder? Peptide 2, retatrutide, the fat loss peptide. You've probably heard of semaglutide, the weight loss drug that took over headlines and waiting rooms everywhere. Retatrutide makes semaglutide look like the first draft. This is next-generation fat loss, where semaglutide targets one mechanism, retatrutide hits 3, all at once. It suppresses appetite aggressively. It accelerates fat burning directly, and it works on multiple hormone pathways simultaneously. The result? People eat less without fighting themselves. Cravings quiet down. The constant background noise of I need food just fades. And the weight loss numbers in early trials aren't just better than semaglutide. They're significantly better. But understand this. Retatrutide doesn't do the work for you. It removes the friction. It lowers the resistance. It gives your body a clearer path. What you do with that path still matters. This is a tool built for people who've tried everything and need the mechanism fixed, not a shortcut built for people who want to avoid the work entirely. Losing fat is powerful, but what happens when an injury refuses to heal, no matter what you do? Peptide 3, TB 500, the injury repair peptide. Some injuries heal in weeks, and some injuries become part of your life. That chronic shoulder pain, the knee that clicks, the hamstring you pulled 18 months ago that still doesn't feel right. Your body tried. Your body is still trying. But something in the repair process stalled. TB 500 works on exactly that. It's a synthetic version of a naturally occurring protein called thymosin beta 4, and its job is deep tissue repair. Tendons, ligaments, muscles, the structures that hold you together and move you forward. What makes TB 500 different from BPC 157 is its focus. Where BPC 157 works broadly across the system, TB 500 goes after long-term structural damage. People report improvements in mobility, flexibility, and range of motion that they'd stopped expecting. Old injuries start to move again. Stiffness softens. The body catches up on repairs it had been putting off. One serious warning though, if you have any history of cancer or active tumors, TB 500 is not for you. Because it promotes cell growth and repair, it can also accelerate growth you don't want. That's not a minor footnote. That's a hard stop. Know your body before you reach for any tool. Healing your body is great, but what if you could go a step further and remove the natural limit on muscle growth itself? Peptide 4, follistatin 344, the muscle sealing remover. Your body doesn't want you to be too muscular. That sounds strange, but it's true. There's a protein called myostatin, and its entire job is to put a ceiling on how much muscle you can build. It's a biological governor, a safety switch, and for most people, it activates long before they ever reach their actual genetic potential. Follistatin 344 blocks myostatin. It doesn't just push against the ceiling. It removes it. The effects are real, faster muscle growth, broken plateaus, increases in both size and strength that people had stopped believing were possible for them. And because it works on the mechanism itself rather than just flooding your system with hormones, it stacks well with other compounds. But this is also one of the more aggressive peptides on this list. You're not nudging a process, you're overriding one, which means the results can be dramatic, and so can the risks if used carelessly. Follistatin 344 is not beginner territory. It's for people who understand their baseline and know exactly what they're asking their body to do. But instead of breaking limits directly, what if you could tell your body to grow naturally from within? Peptide 5, CJC 1295, the growth hormone stimulator. Growth hormone is the backbone of recovery, body composition, and how fast your body adapts to stress. When you're young, your body releases it generously. As you age, that release slows down. And with it, recovery gets harder, fat accumulates easier, sleep becomes lighter, muscle growth stalls. CJC 1295 signals your pituitary gland to produce more growth hormone naturally. Not synthetically injected GH that spikes and crashes. Your own GH released in a more sustained, consistent pattern. The benefits compound quietly. Better sleep, faster recovery, more efficient fat loss, gradual but steady muscle growth. It comes in two versions. A longer-lasting form that requires fewer injections and stays in your system longer, and a shorter-lasting form that gives you more precise control over timing. Most people stack CJC 1295 with ipamorelin, which we'll get to in a moment, because together they create a cleaner, more powerful effect than either does alone. Think of CJC 1295 as turning the volume back up on a system that was slowly going quiet. And once your body starts producing more growth hormone, the next question is, how do you control it perfectly? Peptide 6, IGF-1LR3, the direct muscle builder. Most muscle building pathways go through growth hormone first. IGF-1LR3 skips the line. IGF-1, insulin-like growth factor 1, is what growth hormone converts into inside your body to actually build muscle. LR3 is a longer-lasting version that stays active in your system for hours, not minutes. The effects are direct and measurable. Faster recovery between sessions, real increases in muscle size, improved nutrient delivery, meaning the food you eat actually gets used more efficiently. More muscle, less fat storage. This is the kind of compound that changes what's possible at an advanced level. But there's a risk you need to take seriously. IGF-1LR3 can lower blood sugar. Not in a mild, manageable way, in a way that requires monitoring and awareness. Hypoglycemia is a real concern. Anyone using this needs to understand that, track it, and have a plan. The direct route is powerful. It's also less forgiving. That's the direct route. But what if you could get similar benefits without the harsh side effects? Peptide 7, ipamorelin, the clean GH peptide. Not everyone wants to go hard immediately. And honestly, that's smart. Ipamorelin does something most peptides don't. It stimulates growth hormone release in clean pulses, mimicking how your body naturally releases GH, without triggering the hormones you don't want. No spike in cortisol, no increase in prolactin, just a precise, controlled signal to release growth hormone and nothing else. The benefits are real but gentle. Better sleep quality, gradual fat loss, improved recovery, mild but consistent muscle growth over time. It's the most beginner-friendly peptide on this list. Low side effect profile, smooth learning curve, and it works beautifully stacked with CJC 1295, which is why that combination is one of the most commonly recommended starting points in peptide protocols. If you want the benefits of GH optimization without the aggression of more advanced compounds, ipamorelin is where you start. Now your body is performing better. But what if the changes could show on your face, your skin, even your hair? Peptide 8, GHKCU, the anti-aging peptide. Here's something most people don't think about. You can optimize your body from the inside, build muscle, burn fat, recover faster. But what does the outside look like? GHKCU is a copper peptide, and it works on something most performance peptides completely ignore: your skin. It boosts collagen production, the structural protein responsible for skin firmness and elasticity. It reduces wrinkles. It improves skin tightness. For scars and stretch marks that have become permanent fixtures, GHKCU has shown real results in improving their appearance over time. And there's more. Some users report improvements in hair thickness. Because GHKCU doesn't just repair surface damage, it signals the body to regenerate. It can be applied topically or injected, depending on the target area and depth of effect needed. And unlike most peptides on this list, it has some of the most developed cosmetic research behind it. Your performance is internal, but your recovery shows externally too. Here's the honest truth about peptides. They are not steroids. They are not miracles. They are not shortcuts built for people who want to skip the work. They are tools. Precise, biological tools that work with your body's own systems, not against them. And like any tool, the result depends entirely on how you use them, how much you understand what you're doing, and how honestly you assess your own starting point. BPC 157 and TB 500 for repair. Retatrutide for fat loss. Follistatin 344 for breaking through. CJC 1295 and ipamorelin for optimizing your hormonal foundation. IGF-1 LR3 for direct building. GHKCU for regeneration that shows. Each one is a chapter. Together, they tell the story of a body being rebuilt with intention. But before you reach for any of them, do the research. Understand the risks. Talk to someone who knows your specific health picture. Because the goal isn't to take the most. The goal is to know the most. And now, you're closer to that than you were 8 minutes ago. If this helped you understand something that nobody ever explained clearly, hit the like button. Subscribe if you want more content that actually respects your intelligence. And tell me in the comments which peptide are you most curious about. I'll read every single one.